Hey y'all, so we're in week 8 and I'm going to talk a little bit about respiratory diseases after I fix this slideshow thing. Okay. Hey y'all, we're in week 8 and we're going to talk about respiratory diseases right now. So in general, respiratory diseases are divided into two groups, upper respiratory and lower respiratory. A caveat to that is that these categories are not necessarily mutually exclusive. Some pathogens can infect both the upper and lower respiratory tracts, for example, influenza. They're rough categories intended to guide clinical practice. They're not dogma, if you know what I'm saying. A little bit of look at the anatomy of the respiratory tract. The upper respiratory tract is generally everything above the larynx. Everything below the trachea and the lungs is considered the lower respiratory tract. Pathogens in general opt to go through the mouth and the nose because that's sort of the most open entryway into the body. And so the nose and the mouth have evolved to filter out larger particles. And so we're going to see in a minute that the size of the pathogen matters. Smaller particles are able to go deeper in the lungs. Larger particles are most often colonize the upper respiratory tract. But again, that's not a given. It can be either way. So upper respiratory infections include things like rhinoviruses, coronaviruses, which is always in the news right now, adenoviruses, Coxsackie viruses, hand, foot, and mouth. Conditions include things like the common cold, nasopharyngitis, pharyngitis from group A streptococcal, rhinosinusitis, and epiglottis. Pathogenesis includes direct invasion of the mucosal lining in the upper airway, so pathogens come in and they colonize the tissues right in front of them because that's where they're caught and stuck mostly. Spread is often person to person through secretions that are transferred by touching hands or doorknobs or that kind of thing. So a person sneezes in their hand, shakes your hand, and passes the infection on to you when you touch your mouth as well. Treatment and prevention of URIs. Viral infections are treated symptomatically. There's not many treatments for viral infections to begin with. Streptococcal pharyngitis and epiglottitis are caused by Haemophilus influenzae and treated with antibacterials. Vaccinations, Haemophilus influenzae type B vaccine is given to prevent. So not too much different from viral and bacterial infections and infections which we have vaccines for. Lower respiratory illnesses include viruses. They're smaller and able to make it down into the lower respiratory tract, bronchitis and bronchiolitis. Some bacteria, community-acquired pneumonia, Streptococcus pneumoniae. Conditions include bronchitis, bronchiolitis, and pneumonia. Pathogenesis: organisms enter the distal airway by inhalation, aspiration, or blood contact, multiply in or on the epithelium inside the lungs, causing inflammation, increased mucus secretion, and impaired mucociliary function. Spread can be from person to person. Secretions transferred by hands exposed to pathogens from nose to mouth, or by directly inhaling droplets, which we talked about last time, from an infected person who is coughing or sneezing. Acute respiratory illness, ARIs, globally the most common cause of ill health for children under 5. There's 1.5 to 3.5 million deaths per year. Diseases, of course, run from the common cold, influenza, pneumonia, bronchitis, etc. And agents run the gamut of rhinoviruses, adenoviruses, myxoviruses, and others. Symptoms include mild to severe respiratory disease, usually not life-threatening in healthy adults. In children and immunocompromised people, it can be very serious. Legionnaire's disease, first recognized in 1947. First outbreak was in 1957. That's retrospective. Widespread and often not recognized. 130 people in Philadelphia were hospitalized in 1976. 25 of those died. Agent is a bacteria. Serogroup 1, but there's 48 species and 70 plus subgroups. Symptoms include malaise, myalgia, headache, fever, chills, pulmonary involvement, difficult breathing, and respiratory failure. Associated with air conditioners, because you're in a closed environment, and air conditioners in general are very nice places for bacteria to live and multiply and be spread into the air. ornamental fountains, jacuzzi baths, supermarket vegetable mists, humidifiers, atomic reactor cooling units in pools, and they cause 0 to 5% of community pneumonia. Yeah, Legionnaire's disease. So that is it. This was a short and sweet one, just talking about some general respiratory diseases. We're going to move on to discuss other respiratory diseases and TB.